I didn't realize how many people were affected by not having medical insurance, so that was a big eye-opener.
It takes about 175 hours of volunteers a week to keep the clinic open.
I think there's a misperception in the community. I think the perception is that people with uninsured, that are uninsured or underinsured, are not working, have no want to work, and that's just not the case.
It is probably one of the most rewarding things I've ever done in my life.
We do examinations and screenings, x-rays. We do basic restorative work, extractions, periodontal maintenance.
A number of years ago, Marion General Hospital, which is where I work, had decided and had seen the need for a free clinic here in Grant County, and so they made it one of their strategic initiatives, which is exactly why I got assigned to get a group together. So I pulled a group of community agency leaders and people from the community to do a steering committee and look at the possibilities. We visited about 4 or 5 other clinics in the state of Indiana because we didn't want to do any unnecessary work without being able to borrow from what they've done. And so we were able to really pull together, it took about 70 to 80 community organizations, and we were able to pull the clinic together in a little less than a year's time as far as when we started meeting. So it was really quite an exceptional thing to be a part of, to see how Grant County can pull together and do what's needed to do. When we started, the Taylor University students did a needs survey for us, and it discovered there were probably about 8,000 people in Grant County that would qualify for the clinic. And that means they do not have health insurance provided to them in any other way, and that they fall under what we call the 200% guidelines of the federal poverty standards, and that of course adjusts each year. And so at 8,000 patients, we knew we had our job cut out for us. We have 3 exam rooms, actually 2 exam rooms and 2 dental rooms, so we don't have a lot of space. We're very good at utilizing space, moving patients around and having them wait in different areas while they're seeing their providers. And at this point, we knew we couldn't serve all 8,000. We didn't have the capacity yet to do that, but we have been able, since the clinic started in 2005, we've been able to serve about 2,400 patients. Marion General Hospital and some other agencies are providing some staff for us that is paid salary that helps keep the continuity of care for patients, so that they are people are seeing their labs and different ones coming in. We have some nurse practitioners on staff, very part-time, 10 hours a week. And then we have volunteer physicians that come in, nurse practitioners that are volunteer, exercise specialists, and a variety, pharmacists, nurses, social workers, people that do clerical. So really the volunteers across the board on how we're helping, and we absolutely could not run without volunteers.
I wake up in the middle of the night and I can't feel my arms.
Okay.
They're completely numb. Well, I'm a single mom of 2, and so I know what it's like to not. And I had, they discovered a small tumor in my brain back in October of last year, and I actually was told by a nurse that if I didn't have insurance, to not bother. And I was devastated because I was scared, because they just gave me results and sent me home. And I was going to Ivy Tech for nursing, and I had a wonderful teacher tell me about Bridges. I didn't even know it existed. I'd been here to the food pantry before, but I had no idea about Bridges to Health. So I filled out an application, and they got me in less than 2 weeks, and it normally takes 30 days for the application to process. And I was so desperate in need of some help. Yeah, that hurts. That hurts everywhere.
Now, if you take your chin and come back up, like you're looking at the ceiling.
It's fine, and it wasn't just back pain. I have some depression. I recently lost my mom. And they not only helped me with my medication and seeing a doctor, but they are so nice in here that Nancy even sits and she'll talk to you. Kind of like a counselor. She tries to help you. I don't feel like it's coming to the doctor. I feel like it's seeing friends. They are very open and honest with you, and you can be open and honest with them, and they've helped me immensely. I really thought I was just going to have to pay out of pocket somewhere, which I really couldn't afford, so it's been a blessing to me.
I can't work no more because I got a stroke.
Since we got here, we received the help he usually needs because he got a lot of issues. And every time we come in here, they try to treat us very kind and try to help all the way they can do it. And my husband's been receiving medical care, the care he needs, care we can afford another way.
Well, for them, I don't know where I'd be. You know, all my doctors. They treat me pretty well.
Everybody's nice, courteous, and actually quite fast. You might go to some doctor's office and sit for 45 minutes to an hour. And here you get in, get the job done, and get out.
Yes, this is Anita. I'm a volunteer.
Well, actually, right now I'm serving as the president of the board of directors for Bridges. I've been doing that since the inception, and I also had the privilege of getting the assignment to bring a group together to start the clinic back in 2003.
I'm diabetic, and I didn't have insurance for a while, and I heard about Bridges, and I came down here, and they got me my medicine. And I was talking to one of the ladies because I knew her from outside of here that used to work here. Her name's Carrie Hiley. And Carrie said they're always needing volunteers, and I was like, but I'm not a medical person, I'm just an office person. But she said they needed office people too. That she said you can sit down and you can answer the phone and you can check people in and help with that kind of stuff. And I said okay. So she had me go through the little training and come in and watch a couple of times. And pretty soon I was sitting down here helping, and it's very rewarding because I don't go home any night that I volunteer that I don't feel like I've helped somebody.
Well, my mom asked me to start volunteering, and I started volunteering on Mondays or Tuesday nights in high school, and I carried that over throughout much of college. But in the summer, I was usually gone, so I wasn't able to work in the summertime. But throughout school, I came at least 1 or 2 Mondays a month.
Bridges started right when I got to Marion General Hospital. Marion General Hospital kind of poised Kelly Hostetler to help make this happen. That's when Kelly became underneath me, and so I got involved a lot on the just making this a reality and allowing Kelly to come and see what the hospital can do to make sure that this became a reality.
So I've been really involved from the very beginning, and now I'm doing mostly administrative things, trying to help keep funds coming in, help with organizational things and working with the board. I'm not at the clinic setting near as much as I was in the beginning.
I think it's really rewarding. Some of the gifts I've been given in education, and some of the knowledge to be able to use that and give back to people who don't have that opportunity elsewhere, I think is very rewarding for me personally. And we see lives changed through Bridges to Health, and I think it's beneficial to them, but I take away a lot. I think that benefits me as well, just being able to serve in that way.
I think one of the most rewarding things that I have seen at Bridges when I first started is, there are so many patients who have lost their jobs and are not able to afford medications and things, and I think that they do a wonderful job in providing services to people who just can't afford it. I remember one of our patients that we had early on was a diabetic, and who couldn't afford even the supplies and things, and would use the same syringe over and over again. Lost his job in Thompson's, and just could not afford, and just kind of did with what they had, and I think this was just wonderful to be able to do something for somebody who is in need.
Well, my role is to be a volunteer coordinator. I do all the scheduling for the volunteers, from the nurses to the people who work at the front desk. I schedule every week. We run 2 clinics a week, Tuesday nights and Thursday nights from 5 to 8. So it's my responsibility to make sure all those positions are filled.
My husband is a heart and stroke patient, and we have battled heart disease for over 20-some years. But because I was professionally employed with Marion Community Schools, I had access to good health care. My husband has had excellent health care wherever he needed it and whenever he needed it. And so I feel very fortunate in that respect. And when I retired, I reached a point of I needed to do something more fulfilling with my life. I've loved teaching, but I had that urge to do something more. And I ended up coming to Bridges, volunteering down here because I felt it was my way that I could give back to the healthcare industry.
So I started out just doing volunteer work, and then a couple of years ago I was asked if I would do the recruiting and do the scheduling, and it's been a great job, and I've loved it.
One of the things that I think it always surprises people is to keep a medical practice open with all volunteers, it's quite a challenge, but it's been a good kind of a challenge, and people rise to the occasion. I love to see how people have risen to the occasion to make this clinic do well and thrive.
Whether it be answering the phone, greeting the patient as they come in the door. We have a lot of retired nurses who like to come in and, take vital signs, work up orders for patients. So we want someone who really likes enjoying being around people, because this is a people organization.
There's no stigma on who volunteers here. Everyone's the same, and we're all here from the same thing, from the clerks to the physicians. And that's what I love about working down here.
Ways the community can help Bridges to Health, there's a huge variety of ways. And obviously volunteers, we've already mentioned, is a huge thing that really helps us in getting volunteers. But not everybody has the time or the availability to volunteer. And of course, that we're going to say donations. Donations are also something that we can utilize. But it doesn't always have to be monetary. We've had school groups that will have a drive and bring in copy paper for us, or they may have a drive and bring in ibuprofen, which is an over-the-counter drug that we can use. We have churches that regularly collect pill bottles, and they have to be washed and the label's off when they come in, and we can reuse those then to prescribe out to our patients. Copier paper, we go through it fast. Copier toner, all of those things are huge. We've been very fortunate. We had a wonderful donations of equipment. Marion General Hospital helps us with our computers. Others bring food in. That's another thing. Some of the service clubs will bring food in. Most of our volunteers that do Monday or Tuesday and Thursday clinics actually have not eaten supper. And so bringing in finger foods, drinks, water bottles, etc. are very appreciated by the volunteers. So we have a lot of ways that people can help. I know some of the schools have brought service projects down here, and the teens will come down and help wash, do a heavy cleaning, help us sort things, help us go through and move boxes and reorganize, and help file charts. Different ones will come in and help us file charts, not of course the confidential information, but other things. So there are so many ways that people can be involved in Bridges. It doesn't have to be just volunteering or monetary, but even small donations. We have a list of things that we can give out to any interested organization. I mean, we need baggies, we need garbage bags, we need toilet paper, things like that people don't think about. If you could just buy a couple extra when you go to the store and drop them by the clinic, we would be very grateful.
I'd encourage people to donate some of their time or their gifts, some who don't have the ability to do that, to donate some of their resources to Bridges to Health. I have the joy of seeing how individuals' lives are changed, how people are supported, enabled. Some people are even just surprised themselves that their health could improve, that their quality of life improves through the care they've received at Bridges to Health, and it's exciting to be a part of. So we welcome others to join us in the cause.
From the financial side of things, as the board president and as all of our board members, constantly trying to make sure we can, because we do provide medications free for all of our clients if it's ordered from a Bridges provider. And as we all know, they're very expensive. We utilize the assistance programs from the pharmaceutical companies, but it takes anywhere from 10 to 30 pages of paperwork to get each medication, and so that in itself is a big job for our volunteers and staff to work with here. But in general, we are funded by private donations from individuals, from social service clubs here in the county, from churches. Some local organizations here support us, and different charitable groups that give to us. So we are been very fortunate that we've been able to always operate in the black.
Exciting to be a part of, so we welcome others to join us in the cause.